Hello, today we're going to be talking about the drainage instructions for the Pleurx catheter. I'm going to demonstrate to you how to properly use your Pleurx drain and how to properly drain your patient with the Pleurx catheter. You have your instructions inside your manual, step-by-step instructions telling you how to properly use your Pleurx drain. What you want to make sure is that you have everything available that you're going to need before you actually go out and do the patient's visit. Make sure your supplies is readily available, that you have your Pleurx drain kit, and the instructions in order to drain the patient. The orders from the physician of how much they want you to drain and how often. It should be a written instructions from your physician. Once you get out to the patient's home, make sure you call them and set up a time to let them know that you're coming. Once you get to the patient's home, you want to make sure you take the patient's vital signs. You want to listen to those heart sounds, those lung sounds, and definitely check that patient's O2 sat level. There's a couple of things that is very important that you need to know when you're doing Pleurx drains. The first thing you need to know is that if the patient has a drain that's in the upper cavity of the chest, you can only drain 1,000 mL of fluid off. If the patient has a drain in the abdominal cavity, you can drain up to 2,000 in the home. So you want to make sure you check what the patient has been draining the last couple of visits so that you can be prepared for how many actual kits that you need. Once you get to the patient home, you've already checked their vital signs, making sure everything's okay. Usually the patients are ready for you to drain them. Usually the patients have a dressing that's intact that's covering that drain. Okay, you want to always make sure you wash your hands. So we provide you with the hand sanitizer that you need. So you want to use your hand sanitizer, wash your hands. Even after you take the patient's vital signs and take off your gloves, you're going to wash your hands and put on clean gloves. So I'm going to put on a pair of clean gloves. You got to make sure your hands are completely dry to put on your gloves, because I'm going to remove the old dressing. I'm going to also make sure that I have a trash bag available to put the old dressings in. Okay. So I put on my gloves. The patient has a dressing intact. I take the old dressing off. And what you will see is a catheter in the patient, like this, okay? And usually the tip of the catheter is sterile. It has a cap encapsulated around this catheter, okay? So I usually just put it here on the patient. I put all this in the trash. I usually take this and put it in my gloves and put this in the trash. So this gets thrown away. I take my kit. Try to get you a fill here on the patient's table someplace if you have one. I take out the bottle. Place it on my barrier. Inside of there is a sterile kit. I usually use this too for my trash. I open this using the sterile technique. Away from me first. I usually take my bottle, and when I take this tip, I usually take this and place this just distance away from my sterile field, because this part is sterile. I place it here on my blue sterile field. I go ahead and open up my alcohol pads. There's 3 of them. I open them and I place them away from my sterile field here. Then I will go ahead and put on my sterile gloves. Making sure, again, that I wash my hands before with my hand sanitizer. I put on my sterile gloves. Being careful not to touch anything. So I would take the patient's catheter. And there's a cap that's on this catheter. I take the cap off and throw it in the trash because I've already opened my new sterile cap that's there. I take my first alcohol pad and I clean where I remove my cap. Throw it in the trash. Then I would take my canister cap, making sure my roller clamp is completely closed. This part is sterile, so you want to make sure you don't touch it on anything. I take my cap off of here. It just kind of pops loose like this. And this fits on here, and it goes in counterclockwise and it clicks. Okay, this is not a real catheter, so it clicks, and this is considered the sterile field here. So this is here. We're just pretending that that's connected. I'm trying to see if I can get it to see like it's connected. That's connected there. Then what I do, I take my roller clamp. Again, I check to make sure it's down. This comes off because this is connected. Once I take that off, double checking to make sure my roller clamp is down because you don't want it to just, this is a vacuum tainer, so it's going to vacuum. I slowly push this down, and then I'm going to slowly open my roller clamp, and you'll see it start to drain. Making sure the patient, are you okay? I always double check with my patient to make sure they're okay, and you'll see it starts to drain. Now, if this patient starts complaining of some discomfort, I will stop it immediately. Okay? If for some reason they've been getting back about 300, maybe 500 mLs of fluid or even more, today it's draining an awful lot. So if they can tolerate it, I open it back up again. Just keep it in mind that I can only take off 1,000 if it's up in the chest. Okay? So now it's draining. And I want to keep the numbers where I can see them. So it's getting up to about 700 and it's just barely dripping. The patient start complaining of some discomfort. They say it's enough. I go ahead and cut it off. I disconnect it from here. I take my second alcohol pad. And I clean the catheter site. And I put on my new cap. Counterclockwise and it clicks. Okay. Now this is the key. You want to take your dressing. You're going to take that third alcohol pad before you put that dressing on, and you're going to clean around your insertion site from the inside out. And I'm going to take my foam dressing. My foam dressing goes around my catheter like so. This wraps around on top of my foam dressing to prevent this from going into the patient's skin. I cover it up with a 4x4. And I secure it with my Tegaderm. And again, the secret to using the Tegaderm successfully is to fold it into 3 halves, like so. And if you take it, and if you take that third half that you take and fold it back, put that right on top of the end of that dressing, secure it to the patient. And you will enclose the whole catheter because that's the key. And then this comes off. So that's what you will see when you actually get to the patient's house. The dressing is completely enclosed. Once you finish completely enclosing the dressing, You're going to have the patient sit up. You're going to go ahead and listen to that patient's lung sounds again. Check that patient O2 sat level. Make sure they're in a comfortable position, that they're safe. Then what you're going to do is take your container. You want to always document what it looks like, how much it was. You're going to take this container into the bathroom. This comes off. I usually take my bag with me into the bathroom. I put this inside the trash. I make sure I take this completely off, because if you pour it in the toilet without taking this off, it's going to plop, plop, plop back on to you. So you want to take this whole white part off and pour it in the toilet, dispose of the drainage. Then I take this back and put it in the bag completely. Take off my gloves, put it all in the bag. And I usually have a separate bag to put this in, and then I double bag it and put it inside the trash. Okay. And again, I always document what my drainage looked like, how much it was, how the patient tolerated it. And I make sure the patient is okay before I leave. If you have any questions about anything, there's always instructions inside your reference guide. And the very first time, if you need somebody to go with you, always feel free to call and ask. Thank you so much.